Do you feel that you have left a legacy? If so, what is it?
Well, the legacy would be, of course, I've done holistic medicine. I'm 71. I've done it for over 40 years. And the biggest legacy would be to urge doctors, other doctors, and as you probably know, I've been on tons of radio, TV shows, and still not many doctors do Darkfield microscopy, as you know. And it's really, I had a cardiologist, but he had his cardiology degree from another country, okay? And his name was Tom Dorman. He's passed away, but he didn't have the credentials from America. So I'm not a cardiologist or a hematologist. So my studies with blood have to be confirmed in this country because of credentials. Yeah, I don't have the cred. So you have to have credentials here to impress people. So I'm always sending my book, and I'm always trying to get other cardiologists impressed. Like, for example, this cardiologist I talked to, the one that passed away, he came in here, oh gosh, more than 20 years ago, and he said he's a conservative like I'm, so he thought, oh, I'll give him the benefit of the doubt. So he came in and said, basically, prove to me that you're not full of baloney. So he said, everybody, you take their blood and you put it through air, everybody's going to clot. I said, oh, sit here and watch. So he sat and watched and spent 3 days with me. Imagine, he just gave up 3 days of his work. And when he left here, he totally was humbled. He went out and bought a microscope. Okay, but I mean, we need an American doctor with American credentials, because he had a British accent and he was from South Africa. So that was great, but he did not have, so we need an American doctor to do the same studies that I did, and to prove that 1 out of 3 people out of 100 patients that we tested, 1 out of 3 people is going around with serious clotting. So you certainly don't want to ever ride a motorcycle on American streets, except if you're off in the desert or something. Because I'll tell you, there's so many people with excess clotting out there, it's incredible. 1 out of 3.
So you're saying that if people just take fish oil, then that's enough for them to...
Yeah, we say, it sounds really easy, and it is easy. Just a blood thinner. And you don't have to use fish oil if you're in Hawaii, and if you like bromelain from pineapple, if you could use lots of magnesium, you could use ginkgo ginger ginseng, if the Orientals provide that. You can use cayenne pepper, right? Lots of cayenne pepper, garlic oil. So there's many things that'll break up clots. And it's certainly done, recently, Japanese nattokinase you've heard of, and that's from natto. So there are many relatively cheap anti-clotting agents. And by the way, for the people who like Coumadin, Coumadin has no effect on platelet aggregation, which is clotting. I should sell my book.
Dr. Privitera, we missed your book. Can you show us your book?
Yeah, here it is, and like I say, it's actually old. It kind of reminds me of Ed Griffin, who wrote about the Federal Reserve. His book is like 20 years old, but now it's popular. Well, clotting should always be popular because this is what kills most people. And when you go to the emergency room with chest pain, they don't test you for clotting. Crazy? Yes. Stupid? Yes. And inexpensive. Good point. We charge in Covina $40. I suppose somebody in Beverly Hills is going to charge $60, you know. But relatively inexpensive test.